Hi, I'm Molly Barrows, and welcome to Understanding Medical Marijuana. Of course, medical marijuana is now legal in the state of Florida, and it's been proven to be used in to treat a variety of debilitating conditions. And the group of physicians with East Hill Medical Group are now authorized to prescribe those sorts of those things for folks that may be suffering from some of those debilitating illnesses. So I'd like to introduce to you Dr. Blake Sayer and Dr. Kevin Hogan with East Hill Medical Group. Thank you both so much for joining us.
Yeah, thanks for having us.
And we were talking a moment ago that you've been licensed to prescribe this now, or recommended, if you will, for about a year. So for those folks who are wondering, first of all, what is medical marijuana? Dr. Sayer, what is it in a nutshell for those folks who may be wondering?
Well, it's marijuana that has been approved to be prescribed or written for certain conditions, things like cancer, HIV, AIDS, epilepsy. If you remember Charlotte's Web, that was a big part of that.
Yes.
We also have things like PTSD that are also involved in that.
Well, and it's we'll just go ahead and grab the bull by the horns, but it's known to be sort of a controversial topic. It wasn't until CNN's Dr. Sanjay Gupta did that big series of stories on medical marijuana with the Stanley brothers in Colorado that sort of followed the whole Charlotte's Web strain, the development of that, and how it came about to treat this child with this untreatable form of epilepsy with these seizures that were just killing her essentially. Mm-hmm. So there's this dramatic shift that it's not just something you take to get high and experience something euphoric in order to have a good time, if you will. That this has a medicinal use that is separate from that perception. So, Dr. Hogan, how did you come to the decision to be a part of this new initiative, if you will?
Well, as a chiropractor, I see patients with chronic, debilitating pain, and sometimes they're looking to head down that road to pain management. And when this became available here in the state of Florida, I just knew it was something that we needed to take on.
Was it a difficult process to become licensed to do this, to be able to recommend it to patients?
I guess I'll take that one. Initially, we had to take an 8-hour course, and then after that, we had to take a second course that was about 2 hours, where it went through a lot of the interactions and the legalities, and for instance, why there's no studies in the in the country. The FDA and the DOJ have to agree on the validity of a study, and so if they don't agree, it's not done. So it's just never done.
Right, and so there's actually a whole lot more to that, I'm sure, that we could probably explain to listeners and viewers. But
absolutely.
In a nutshell, between the Federal Drug Safety Administration as well as the Department of Justice, until they come on common ground as federally how we should approach this. In the meantime, it is legal in the state of Florida. So those folks who may be concerned about pursuing this as a treatment for a potential illness or something that's causing them pain, they should not be concerned, correct? What do you think, Dr. Hogan?
Yeah, no, not at all. Not at all. It's completely legal here in the state of Florida.
That's excellent. So let's talk a little bit about the debilitating diseases that this addresses, because I think for the folks who may be slightly familiar with what they've seen in the media reports already, they're thinking kids with seizures or various people with disabilities that have seizures, and that those are the symptoms. But it does treat just a whole widespread array of illnesses.
Certainly.
Can you talk a little bit about that?
Sure. Well, one of the main ones that we treat is going to be pain. I mean, hands down, that's the number one reason why people seek us out. I've had people be able to get off of their pain medications completely, and certainly in every case, lower the amount of medication that they're taking. We have patients that are HIV positive and or have AIDS that it helps them with their appetites. We have PTSD. We have a large service population here in this part of Florida, and so we have a lot of those patients that come in because they have, unfortunately, have some pretty traumatic experiences in the military.
Yes, and we have such a widespread, actually, military population in this area, and between what they experience in war, whether it's emotionally traumatic or physically traumatic, and then you also have sports, which is a whole another arena. You've got the big discussion of concussions coming up as well, and it seems like that there's a whole field of potential when it comes to medical marijuana. And is that what you find with patients when they walk through the door? Do they have a whole field of questions about it as well?
They do. A lot of it's about the legality, and then a lot of it's about how it's going to be administered. So we go over all of that. There are a plethora of ways for it to be administered. So it takes quite a while to handle all of those questions. Some patients don't want to have certain forms and want to have others. So we make those available.
Excellent. Let's talk a little bit about the way that this is administered. That
Sure.
this is, I guess you would describe this medication, and it's not. I think perhaps maybe an uphill battle with perception and what people perceive as marijuana. The medicinal marijuana is nothing like what they may have seen in different versions and forms and media. Can you tell us a little bit about what you have here?
Well, sure. We have, these are not at all the encompassing numbers of forms that we administer. There's tinctures that can be administered in the mouth, under the tongue. We have patches over here. We do have the ability to vape in the state of Florida. It's not legal to actually set fire to marijuana at this point. There's capsules, so that's an oral administration. We even have a topical. You have a sore knee or a sore ankle, a toe with gout, then you can actually just put this on that area and not actually, treat or have the THC or anything like that in your body. It stays where you put it.
All right, and I'd love to get to that in just a second to explain to folks what the difference is between the different chemicals that cause the euphoric high and those that are just within the medicinal treatment itself that doesn't create that. I do believe we have a caller on hold, so I'm going to go ahead and try to take this call and see if this person is ready with their question. If you guys are ready to take it.
Sure.
Hello. This is.
Yes, I got a question.
Yes. Hi.
Yeah.
Is this William or Harold?
Yeah.
Hi. Go ahead, William.
Hey, listen, I work at a company, and we've got a zero tolerance for any trace of drugs or stuff in your system, and we can get tested any time. What are you supposed to do if you're on this this marijuana, and then you get tested and then you get fired? I mean, is there how are you supposed to handle something like that? Do you go to your HR person and a human resources person and let them know that you're taking this medication? And I'll hang up and listen to hear what you'll have to say. Thank you.
Thank you so much for the call.
Well, I'll take that one because it's a pretty common question that I get. And certainly before he starts using medicinal marijuana, that he should probably go to his HR and have a conversation. If he's concerned, then maybe there's a way to do it anonymously, so that they don't start really trying to watch what he's doing. I would worry about that. But as far as what kind of protections do they have, we don't know. I mean, unfortunately, somebody's probably going to have to get in trouble, and then they're going to have to fight it, and then there's going to have to be some case law that will guide law enforcement and also the large corporations, large and small. But there just isn't really any guidance on that. We have questions about what do you do when you leave the state. I don't know.
Right. There's a lot that's up in the air, but when folks are wanting something that's effective for themselves, sometimes they're willing to take that chance.
And I'm sure most businesses probably look at it like any other prescription medication. I mean, it's not necessarily something that you can be using during your work hours necessarily.
Absolutely.
It's just like anything else that you're taking.
Yeah, that's very true. Well, you mentioned a moment ago about THC, and if you could just do, whoever you feel like is best to answer it, but if you could just do a basic biology explanation, if you will, of the differences between like THC, people's perception of the party drug, and the medicinal marijuana.
Well, I mean, to be clear, that the marijuana with THC is absolutely available in the state of Florida, but we also have a different form, which is CBD, and so that's cannabidiol, and that does not contain the THC. The THC is the chemical that's going to make someone high. So you take that out, and then you have a product that works almost as well, if not as well, as the true marijuana with the THC. I have people that come in again and tell me that their pain is gone and are 80-90% gone just with CBD.
So if they're concerned about, hey, I might want to use this as a treatment, but I don't want to experience what I've heard is this euphoric high, this is an option for them. And it seems as though, and even watching the video of the Open, you had the little girl that was taking it, and that's probably got to be a little shocking for some folks to see that it can be administered that way. But I guess it's about changing their perception again of what this actually is, and it can be used as a food supplement, an inhalant, you basically pointed out, in a variety of ways. And it sounds like it depends upon whatever illness that you're trying to treat.
Sure, and of course the age of the patient is real important with that.
Are you getting a range of age of patients, or do you find that it's still sort of a slow bill with certain groups?
We're getting everywhere down to my youngest patient currently is elementary school, with seizures, of course. That would be one of the few indications to use for children, and then all the way up into some pretty advanced stage seniors.
They're looking for alternatives.
Mm-hmm.
Talk a little bit about why this is potentially a better alternative than a lot of these prescription drugs that you mentioned earlier. Maybe folks have hit a dead end, or maybe they're getting some negative side effects from some of these heavier prescription drugs, or maybe they're looking for something to supplement what they're already taking. What do you hear from patients about why this could be a potentially better alternative?
Well, primarily it's the side effects. You have opioid-induced constipation, which is one of the main side effects that people fuss about a lot. Then you also have addiction, and that's those two together are the majority of the complaints. Then of course you do have some euphoria that you can achieve from these as well. So particularly my seniors are not really interested in doing a lot of the THC containing products. They're more interested in the CBD. I'm not sure if I answered your question.
No, that was perfect. That was great, talking about the differences in between the two. What is the process like for a patient who is interested in becoming a medical marijuana patient? How do they go about doing that or exploring the option?
First thing they do usually is we're going to need to get their records from whoever's been treating them for their qualifying conditions. So we usually have to send some records requests out to receive those. Once we receive those, Dr. Sayer reviews them, make sure they have a qualifying condition. Then they come in and he does an exam on them, and they discuss what routes they might want to take. And once that's all completed, it gets sent up to the state's computer system. Then the patient has to also upload a passport photo, send off a couple dollars to the state, of course, and then it's a waiting process until you get approved.
What is the general waiting period?
Well, I was just speaking with one of the dispensaries reps today, and he said that they've got the days down to maybe as few as 10. So it's really improved. I mean, it was 3 to 4 weeks, so it's really greatly improved. Now, they're not going to get their card right away. Their card's not going to come until 3 months maybe after they get all their stuff. And the time that I'm talking about, it starts ticking when they've finished all of their application process. But they have a new process that I just heard was rolled out. They can pull your DMV photo now, so you don't actually have to have that passport photo. It just rolled out.
So it makes it a little more convenient.
And you can still go pick up the medication that you need even though you don't have the card yet.
Correct.
You're in their system. So if you go to any of the dispensaries here in town, you're already in their system. They know what you're supposed to get, and you can kind of take care of it from there.
Well, in a traditional medical setting for a patient who's going to a doctor, perhaps to be treated for some sort of injury or some sort of pain treatment, they might say, trust that doctor implicitly as to whatever prescription that they're giving, because there's a process in place federally that says we've tested this drug, we've looked at this company that's made it, we feel comfortable with it. With medical marijuana, you're talking about a wild west, if you will, without a lot of studies, a gray no man's land, if you will, as far as Mr. Harrell's question a little while ago as to what's legal and what you can and can't take at your workplace. But so what do you tell folks when they walk in and they're looking for answers to those sort of questions?
Well, I usually ask them what exactly they want and what kind of preconceived ideas they have. A point that I want to make is that the CBD is available over the counter. I just heard Walmart stocking it, but it is not CBD made from medicinal marijuana plants. So it's nowhere near as effective. And so I have to correct people's misconceptions frequently when they come in. They go, "Oh, I've heard CBD doesn't work." And I'm like, well, the CBD that you could obtain on your own doesn't. So let's try this. But I have people who have smoked before, so the vapes don't seem to be a problem for them. But
right.
For some people,
but they can have trust in the product. And hold that thought for 1 second. We have a caller right now. We'll see what their question is. Hello.
Hello.
Hi, and welcome to Understanding Medical Marijuana. Did you have a question?
Yes, I'd like to ask if they treat fibromyalgia.
Is it something that's used to treat fibromyalgia?
that would fall under the heading of chronic pain, and so absolutely, I treat a lot of patients with fibromyalgia, and I can tell you that you will find relief.
So you've had success, and that's more to the
Absolutely.
point, I guess, of the question that we were talking about a moment ago. If folks come in and say, well, there aren't a lot of studies, there's no process in place for proving that these are even effective, what are you relying it on? Is it based on some unofficial studies, if you will? Is it word of mouth? What do you tell folks who may have some questions about its effectiveness?
A lot of it's anecdotal. I mean, it's self-reporting from patients, but then we do have studies that have come out of other parts of the world, just not United States. And we've always in the United States have always been resistant to, taking studies from other places. But doesn't mean that they're not quality studies. But most of it is truly just reporting by the patients themselves.
Yeah, we have lots of patients that come back and just say it's changed their lives.
Absolutely.
I mean, every day.
Excellent. Well,
A
let's
lot.
talk a little bit more about that. We're going to take a break. You are watching Understanding Medical Marijuana with Doctors Hogan and Sayer with the East Hill Medical Clinic. Stay with us.
Did you know that low THC medical cannabis can be used to treat a variety of ailments, including back pain, anxiety, anorexia, migraines, seizures, muscular dystrophy, Crohn's disease, severe and chronic pain, wasting syndrome, AIDS, and more? If you are a permanent resident of Florida, you may qualify for a treatment that will vastly improve your quality of life. Medical cannabis is a legally accepted treatment in many states throughout the U.S. and is endorsed by premier medical facilities. Getting started is simple. Schedule an appointment with our approved physician at East Hill Medical Group. If your condition qualifies, our physician will provide you with an immediate recommendation. You get access to the products you need to start feeling better. Every 7 months, you'll see our physician for a checkup to keep an active profile. Call 850-437-0035 today to set up your initial evaluation.
Are you ready to lose 3 to 9 inches of fat in as little as 2 weeks with no pain?
East Hill Laser and Aesthetics offers Zerona, the first FDA-proven safe and effective treatment to remove fat from your waist, hips, and thighs. No surgery, no side effects, and no downtime. Zerona's clinically proven technology uses a painless laser to empty your fat cells and restore them to a smaller size.
2 weeks of Zerona is now just $995. Call East Hill Laser and Aesthetics today to schedule your consultation.
Hi, and welcome back. You're watching Understanding Medical Marijuana with the East Hill Medical Group. We're talking to doctors Kevin Hogan as well as Blake Sayer, and they're answering our questions about medicinal marijuana. And before we left for break, we were talking about the difference that this has made in patients' lives because of the lack of studies, if you will, that show proven effectiveness. A lot of it is anecdotal. And Kevin, you were saying that you hear from your patients that this is significantly improved their lives.
Oh, they come in and they just say they've been able to get off their medication, and a lot of things have changed for them since they started using medical marijuana. And then they tell their friends. So we get a lot of referrals from just patients being successful through using this product.
And products like this, you were mentioning, go through a rigorous testing process. It's not as if somebody just makes them in their garage
Sure.
and shoves them out there and says, hey, it's medicinal marijuana.
Well, we get a lot of patients that, like Dr. Say was saying, they smoke already, because that's the only way they're able to get, marijuana. And the problem with that is when you go buy it from someone down the road, you don't know if you're getting the same thing every time. When you have a card and you go to the dispensaries, this stuff goes through a rigorous testing process. You're going to get the same thing every time you go there, which, can be beneficial as well.
Excellent. Well, I believe we have another call, and looks like we have a couple. I'll go ahead and take the first one. I hope this works out. We'll find out. Hi, is this Taylor Kelly? Hello? Let's try this. Hi, did you have a question? Hello?
Hi, is this Black?
Yes, thank you so much. You've reached Understanding Medical Marijuana. Did you have a question?
I do. I'm just catching the program, but I wanted to know, as far as stomach issues and intestinal issues and nausea, I've heard rumors, but I don't really know the real story about how that could possibly help with that.
So your question is, can it help with nausea and other stomach issues?
Well, yeah, and serious issues. I have something called gastroparesis.
Is this something y'all are familiar with?
Well, absolutely. And one of the things that you really would want to avoid is any kind of opiate pain medication with motility problems. So, I mean, certainly you would want to be careful. But, Crohn's disease is listed as one of the qualifying conditions that was initially approved by the voters in the state of Florida. So that would probably fit under like conditions. We don't really have explanations as to why these THC and CBD affect the body and helps with nausea and appetite as of yet, but we just know they work.
Okay, because I've wondered about that for a long time.
Yeah, I would
Okay,
think
well,
that you'd be a
thank you.
candidate.
Excellent. Well, thank you so much for your call. I appreciate the question, and they can always check out your website for
Absolutely.
additional information. It's East Hill Medical Group.
Yep.
Excellent. All right. Well, thank you so much. Did you have anything further for the doctors?
No, that was it. Thank you so much.
All right.
you.
Thank you. I think we may have another call. Let's see. Hi. Did you have a question?
Oh, hi. Yes, this is Kelly, and I would like to know what the difference is between THC and CBD.
Thank you so much, Kelly. I appreciate that. We were talking about that a little bit before, and it is interesting when you're talking about this issue. You have to throw out so many, scientific terms and sort of acronyms, if you will, and it becomes confusing for people. So, what is the difference between those two?
Some of those things are still being determined, but primarily the THC is the product or the substance in marijuana that's going to provide the euphoria, the high, and the CBD, along with terpenes, are the ones that go behind the scenes and provide relief of symptoms that you're trying to treat. The terpenes, I mentioned those just a second ago. Those are the things that give the different strains of marijuana a little bit different effect. So we do have a dispensary here in town, True Leaf, where they have different strains, and so they will help tailor your experience or what products you purchase based on what conditions you're trying to treat.
Does that help answer your question, Kelly?
It does. I just hear so many of the acronyms, and so it gets confusing.
Well, CBD is cannabidiol, and it activates the endocannabinoid system in the body, which is kind of plugged into everything. It's kind of interesting that this system has just been sitting around in our bodies waiting for CBD to activate it.
Interesting. So it actually works with your body's functions.
It
if you
absolutely
will.
does.
Excellent. Any other questions?
No, I'm good. Thank you.
Excellent. Thank you so much for the call.
And a lot of patients, they mix it, they'll do like CBD during the daytime and the THC at night. Patients that are concerned with, the whole euphoric high portion of it while, at work and things of that nature. They can do the CBD end of it during the daytime and the THC in the evening.
Well, we talked a moment ago a little bit about the different illnesses that this can treat, and it was a narrow range initially when the law was passed. But since then, it's been what the term that you mentioned was like-minded, if you will.
Like conditions.
Like conditions that were similar to the ones that were already approved. What does that mean exactly? So if you're sitting at home going, I have headaches, but I don't know if it's like migraine enough to qualify for this, or I have aches and pains, I don't know if it's fibromyalgia, what would qualify as a like condition?
Well, one of the main ones that we treat in the office is anxiety. Anxiety is not listed as one of the qualifying conditions, but yet PTSD is. And so a large portion of PTSD is an anxiety or an anxiousness. And so that's how we can use that as a like condition. You could use probably Crohn's on there to treat something, say, like ulcerative colitis. With pain, that's a huge just umbrella of anything that's painful.
Okay.
I mean, so it doesn't matter about the specific condition. It's just pain in and of itself.
Gotcha. All right, well, I think we have another call.
Okay.
Hi, thank you for calling. Did you have a question?
I do. Why is medical marijuana regulated differently than other prescription medications?
Great question.
That is a good question.
And it might be a little bit more complicated than you can cover in the show, but I'll hang up and listen to the answer.
No, that sounds wonderful. Thank you so
Thank
much for
you.
the call.
Thanks. Bye-bye.
It's really pretty simple. It's simply just not regulated by the FDA. It's not federally approved, so the FDA doesn't put any kind of regulations on it whatsoever. and so it simply is not a prescription. So it kind of has to, we've sort of sidestepped the federal laws here by voting by the state to change the Constitution.
Right, and obviously so many states have done the same, and we have yet to see any real litigation that tests that. So we're waiting to see if the Department of Justice will maintain that sort of truce, if you will. So we'll continue to see. But it is an interesting question, though, when you're trying to determine if this is something that's reasonable for you. But it seems like for so many folks, it's really about just the rewards they get compared to the risks they may take by continuing to take medications that have such painful side effects. So do you find in general that it is worth exploring for those folks who may be especially on the fence or just considering weighing their options, that it's worth coming in just to talk to you a little bit about what their conditions are, their complaints are, and if this could potentially be a good fit?
Well, I mean, I think it's super important for them to come in if they have questions, and we'd be more than happy to answer them. We'll have people that come in and are very nervous about it. They talk even in hushed tones, and they're concerned about getting their names on the registry, and if the federal government has access to that. Then I see them again, and they come back and they tell me something like that we might have saved their marriage, just simply because one of the two involved in that marriage is no longer grumpy and in pain all the time.
Yeah, so it's a life-changing, impactful experience.
Yes.
Well, in the minute that we have left, is there anything else that you think would be important to add for those folks who may be listening or watching or considering trying this?
Definitely just to look into it. I mean, like a lot of our patients, they've been down the pain management route, or they've been under all kinds of medications for their issues for long periods of time, and this is just another avenue, something that they can pursue and look at that might help them immensely.
I agree.
Absolutely. And cost-wise, I know that's probably a whole other topic, but just cost-wise, how does it compare quickly to perhaps prescription medication?
It would depend on whether they were using a generic or not. I mean, this is not without its cost, but it's probably comparable, if less. And we are getting some people not buying on the streets anymore, and that's probably cheaper.
Absolutely.
To get it here.
Absolutely. And such an amazing difference that it's making in the lives of your patients. So thank you both so much for joining us on Blab tonight. We appreciate our callers with their questions. Thank you for watching Understanding Medical Marijuana. We hope this answered some of your questions, and if you have more, you can check out easthillmedicalgroup.com. Thank you so much for watching.